Good afternoon and welcome to yet another press briefing here at our GIS studios. I would like to welcome the media as well as our panel, our viewing and listening public. On our panel today, we have His Excellency Governor Martin Roper, along with our Premier, the Honourable Alden McLaughlin, Minister of Health, the Honourable Dwayne Seymour, Dr. John Lee, Chief Medical Officer, Dr. Samuel Williams Rodriguez, the Medical Officer of Health, as well as we'd like to welcome Police Commissioner Derek Byrne with us here today. We're going to begin with Dr. John Lee as he makes a statement.
Good afternoon. We previously announced the results of 20 tests which were run on Monday. The tests which were run and completed yesterday evening were numbered at 40. Of these, 29 tests that originated from the Health Services Authority were negative. These results remain preliminary until our testing process has been confirmed by CARFA. Of the 9 remaining tests that we've been awaiting the results from Health City, 2 samples were positive for the COVID disease and 9 were negative. We currently have 7 outstanding tests which will be run, which are running at the moment.
With that, we'd like to start the questions. If you have any questions surrounding the test results, we'd like to deal with those first and then move on to the rest of the panel. Yeah?
Thank you. Thank you, Donna. Dr. Lee, thank you for the information. Can you provide us with some details on these cases in terms of the interaction? What should the public do following these new results?
There's nothing in particular for the public to do. Public Health England has gone through the processes and the contacts at Health City. All of the contacts and the close contacts of the primary case, the person who's now passed away, have been isolated from the moment that was thought to be a possibility, and they remain on isolation, especially because, as you know, I've announced that the results are preliminary until we say they're no longer preliminary, the results. So even though I've announced the results, everybody will remain on isolation, the 30 people that were isolated until 40 people, 30, 40, I'm confused with all my numbers, but the people remain on isolation until the end of a period or until they're symptom-free, the 2 who are positive. The 2 are positive. Our test process is that they would need to have repeat tests before they were released.
Without sharing too much personal information with these 2 the positive cases, is it medical staff or the regular staff? And what should the public do for those who would have attended Health City and possibly interacted with these individuals?
Yeah. I'm not privy to all of the information about the members of staff, but I know that they're members of staff. I believe they were nursing staff, but I cannot, medical staff, but I cannot say absolutely because I don't know the details of the staff. But the risk assessment has been done by Public Health England, so they've gone through and decided who is a contact of a contact, and essentially at some point when you're tracing contacts, you will discontinue your contact tracing and just say anybody else would need to report symptoms and then would need to be picked up from there. But nobody has been picked up in that category yet.
A lot of people may ask, is it now time to start wearing masks when they go out in public and interact? We see large crowds going to the supermarket. What would be your advice now that we have these 2 cases?
The advice doesn't really change from the advice that we've been giving all the while, which is maintain your distance and keep your hands clean, take respiratory precautions. No, I wouldn't advise you to wear masks. The reason we say that is because if you don't have symptoms, you're unlikely. You're not likely to be able to pass on the virus, and that is the whole issue. That if you don't have symptoms, but the moment you have symptoms, that is the time that you should isolate yourself. People may ask about. Some people say you will have the virus immediately before you start to have symptoms. Yes, that's correct, but you won't actually be shedding any virus until such time as you have symptoms, because you don't have any symptoms to shed it.
Now, you've quantified your statement by saying these two individuals are medical staff. So these are our first locally transmitted cases, correct?
No, they're still contacts of a traveller, so that would not count as locally transmitted. It's related to a traveller incident.
So what sort of risk is there to the public from these two cases, this new information that you're sharing with us?
At the moment, I am very much reassured because, we only have two. The numbers of people were locked down pretty quickly when we knew, and we don't seem to have seen anything else pop up. So I'm hopeful. I can't be categoric about it, but I'm hopeful that it's been contained adequately.
I have a few questions from the public, and then we're going to move on from there. One person is saying that Jamaica is reporting areas where persons are quarantined and how many people are actually in quarantine because of positive results. Is that something that we plan to do now that we have some positive results?
We don't have any evidence of community transmission, so those sorts of decisions would be, as it's been said before, is a very dynamic situation. That sort of decision would be made in the future, depending on the circumstances. But we don't have any evidence that there is community transmission at the moment.
Okay. Also, one person wants to know, are you satisfied with the amount of testing that we're doing? Because everywhere is saying test as many people as you can. Are you satisfied with what we're doing so far?
The testing issue, again, is a dynamic situation. There is a worldwide, and we all know how it's difficult to get things in a small island. We have limitations in the number of the reagents we can have. Many of you will have seen online that there are test kits that are coming on. You put a drop of blood and the result comes out. They needed to be validated, but we're getting really close to that. So the whole attitude to how we test will change if testing is readily available. At the moment, it's not readily available, so we have to follow protocols in order to make sure that we keep the population as safe as we can with the reagents that we have. More reagents should be coming from PAHO. Some are already on their way, but again, it's not a huge supply. It's an amount. We've also requested reagents from Public Health England. I've been advised from Public Health England that they're finding it really difficult to source all sorts of materials and supplies that we need for this particular condition. If we had limitless supply, we would have a different process, but we have to work where we are at the moment.
Okay, and some persons are asking you just to clarify the numbers that you presented at the beginning.
Yeah, so 20 tests were run earlier in the week and reported on Tuesday. 40 tests were run yesterday and we're reporting on now. Of the ones I'm reporting today, 2 were positive and 9 were negative from Health City and 29 were negative from the Health Services Authority. And we have current tests outstanding. At the last count it was 7, but we are testing all the while, so that number may actually be a bit larger and be reported tomorrow.
Okay, thank you, Dr. Lee. Premier McLaughlin or His Excellency?
Well, just let me comment on this. As Dr. Lee has just said, there is still no evidence of community transmission or community spread. But here is the harsh reality. Last year, Cayman welcomed 2.5 million visitors. Caymanians and residents love to travel. The point I'm making by that is, it is almost inevitable that there will be other people in this community who test positive for COVID-19. That is why the protocols and the advice that we continually give about how to change your behaviors in light of this global health threat are so important. The advice about social distancing, the advice about washing your hands, the advice about being very careful around older people, all of those are more and more important. It is, we believe, still possible that we can avoid the kind of meltdown that we've seen in other places, but that is only possible as a result of changed behaviors. I think that's the point I want to make. There is a great deal of the principal point I want to make. There's a great deal of concern about the arriving students. I say to people, because my phone lights up 40 times a day on this particular issue, we are doing everything we can as a government to provide the opportunity for those who are arriving on these flights to be able to self-isolate. And let's hope that every single one of those returning residents, because they're not just the students, does follow the protocol that we set out, does behave responsibly. But there are thousands more who would have traveled over the course of the last 14 days. And many of those people are not self-isolating, are not behaving responsibly, are not locking down their entire households because one member has traveled. All of these things create real risks to the broader community. So please let's not treat, as I'm starting to fear, those who are returning on the BA flights over the course of the next few days as pariahs, while we forget and forgive what I know to be irresponsible conduct among many in this community who have just concluded they don't have the virus so they can go back to work and they can hang out or do whatever they want to do. I see some of these people with my own eyes, not just the evidence that is being fed to me on a daily basis. If we are to contain this, we have got to start taking the protocols very, very seriously.
Yeah, let me just add. I mean, I agree with everything the Premier has said. I mean, we are dealing with a global health emergency and a global economic and financial emergency. But when we step back and look at where we are in Cayman, there is no reason for enormous public concern about the news we've had today. It's actually only 2 people at Health City who were infected because a person came off the cruise ship. So that situation has been isolated, it's been contained. There should be no reason for any major new concerns today. But I absolutely agree with everything the Premier has said, because this is about individual responsibility, and all of us have to do what is needed to make sure we're following all the health advice. And we're doing, again, I applaud all the measures taken by the government. We've put ourselves in the best position we possibly could be in today, and compared to many other countries and places around the world, we are in a far better position than those. If I could just cover a few other issues. I mean, first of all, I would like to say a big thank you to Public Health England, who have been with us all week but are about to depart. They've provided really helpful assistance on the testing capacity that we now have up and running, and we're seeing that's up and running in a very effective way. And they have expressed to me and the Premier their full confidence in the testing system that we have set up here. Of course, we want to be absolutely sure and send the results to CARPA, but Public Health England leave very confident that we have a very robust and effective testing system on Ireland. And that's a credit to Dr. Lee and everybody at the health authorities, because we're the only overseas territory that can do that. Just a quick word on law and order. And a lot of people have asked me about the security situation, and today I've invited the Police Commissioner to join us. So if there are specific questions on that, I know he'd be very pleased to answer them. We've already been talking about contingency plans on law and order, and I have every confidence in our law enforcement agencies that they will step up when needed, as they have in the past. I've also set up a core security group which is meeting regularly to make sure we're keeping a very close handle on this. Can I just say a word about the British Airways flight? There's been a lot of confusion about this. I think we have to recognise that for the International Aviation Agency, this is a time of great uncertainty, even chaos. So there was a glitch on the British Airways website, but as we have said, as my office has said from the beginning, the flight on Sunday is confirmed. It is still confirmed, and that flight will go out on Sunday. And I do want to say again that my office is very open and available to check any information that people have. We have a wide range of very senior contacts here in the UK and elsewhere. And if people have information they want to check, we are very willing to check that and get back to people quickly. And I would just say that the social media sites that we're using, Instagram, Facebook, and Twitter, are there, and we're putting out lots of information on those, so please do access them. I also want to say again, and a number of people have said that they really appreciate all the messaging around avoiding fake news. And I think we just have to keep saying this because we're still getting so many examples of fake news. And it really is incumbent on all of us to check information before we put it around on social media. And as I've discussed with the police commissioner, we will do everything within the law to take action against people who create panic and alarm through the spreading of fake information. So let me just conclude by saying again that I think we can get through this, and I think we are in as good a place as we could be. But as the Premier said, the basic hygiene, washing your hands, and I'm actually enjoying washing my hands so often. I don't know about you, I find it therapeutic. But we need to continue doing that. And if we have symptoms, self-isolate immediately. And again, there is no need for panic buying. There are absolutely no shortages of any kind for the vast majority of goods that people need. And as I've said from the beginning, this is a time to really come together and think about all our friends, our family, our colleagues, everybody on the islands, and support people in a truly Cayman-kind way that these islands are known for. Thank you.
Thank you, Your Excellency. Mr. Seymour, you have something to say?
Thank you and good evening to listening public. Every day we have these press conferences to try to keep the public up to date with what's going on here locally in these beloved islands. And we know that people are stressed out there. Just had the dump burning last week. Now we got COVID-19 evoking fear in this community. And we want to ask people to take a moment, meditate, do some exercise and get some sleep, and to ensure that we can beat this. The measures that we've put in place, the restrictions that we've put on, is all to help you and to help the Cayman Islands get back to some kind of normalcy in a very expeditious time. Please, if you feel any symptoms, call the hotlines immediately. If you don't feel you get the information that you needed to get and other symptoms have come on, call the hotline again and they will instruct you what to do or where to go. I mentioned yesterday that they had a mental health hotline and my phone was blowing up. Unfortunately, it was a number that they were working on and will be provided soonest to the public as soon as we get that. But it's being worked on soon. We'll soon have that out to you. So people are losing jobs. It's quite chaotic. The government is doing everything. Some people are calling saying, oh, well, they didn't mention my sector of business. What I'm asking people to do is, if we have situations out there that the government doesn't know about, we must gather those persons together, gather the names, etc. If if it's in a certain sector, and send it in to us so that we can consider or appreciate how bad the situation is out there, to see what the government can do to assist in some way. We know NAU has been geared up to take on additional persons, to help additional persons, and we want you to respect NAU in terms of it is busy as it is all year long. So please appreciate if you have to wait a bit, because they're also staffing up to have more help available so that they can help as much people as possible. But stay safe and remember to keep your distance. Thank you.
I'm going to start with one question from the public that's
think,
asking
Donna?
about logistics.
Dr. Lee had a few more points.
Sure. Go ahead, Dr. Lee, please. Go
Thank
right
you.
ahead.
Thanks. Thank you. It was just really a little bit more of a medical update.
Sure.
I really think it's cause for celebration today. I know we may be feeling down, but it's cause for celebration that the Chinese reported no new cases of COVID. It's taken 8 weeks in their lockdown, and they appear to be coming out of the other end. So they've achieved an awful lot. I wanted to clarify the details of burial and cremation for anybody that maybe have died with COVID. Essentially, once the patient has passed, there's no particular requirement. So it's universal requirements, and that information is the information that I've previously mentioned that I'd shared with the funeral homes. So it's pretty straightforward, because every funeral home will deal with the body as if it may have potentially have some infection. So there's no restriction on viewing, there's no restriction on embalming, and so on. Lastly, just to follow up on His Excellency's point, I mean, the skills and dedication of the staff at the HSA who work in the laboratories have been amazing in this regard. They really pulled out all the stops, and it had nothing to do with me. It was all the HSA staff and with Dr. Williams' support, and I really do thank them for that. Thank you.
Dr. Lee, you just mentioned about cremation and viewing of the bodies and so on and so forth, that's okay. However, the groups need to be that 50 or minimum number of people at a viewing of a body, 50 or minimum people.
Yes, I'm sorry, I'm not. Yes, it would need to comply with the gathering guidelines.
Okay.
Yes, of course.
Okay, I just wanted to make sure of that because somebody will certainly ask the question.
Yeah.
Okay.
Yeah, not at the moment.
So the first question to the panel is about logistics. As far as the students who are coming in, can somebody explain in depth the logistics surrounding the students who will be arriving? Mayor McLaughlin, if you could speak to the logistics around the students who are coming in, how they'll be transported, so on and so forth.
Okay, thank you. I've just been handed some briefing notes, which are quite detailed, so please bear with me. The NEOC hotline and email went live last night to receive calls regarding the dedicated isolation facility intended for returning students aged 18 or over. Technical issues which were initially reported when the call center launched have been resolved. As of 1 p.m. today, a total of 66 students who are coming on international flights through Sunday the 22nd of March confirmed their plans to utilize the dedicated isolation facility. Already today, a total of 12 have arrived and have been transported directly from the air side of the airport to the hotel. At the facilities, students will be provided with free accommodations, meals, and Wi-Fi. Personnel have been stationed at the airport to oversee the process and to assist the students. House rules for persons residing in the facility have been provided to students. We expect more students to avail themselves of the option in the coming days. The hotline is 1-800-534-6555. 1-800-534-6555. The email address is neoc@gov.ky. neoc@gov.ky. We have thus far reserved 100 rooms and 200 beds. Negotiations are ongoing if the situation requires more. A separate facility has been opened to essential staff whose home is expected to be impacted by returning travelers. So far, 5 persons have been approved to use this facility so as to ensure the seamless delivery of services by the HSA, Uniform Services, and 911. Additionally, arrangements have been made to accommodate inbound passengers on international flights who are transiting Grand Cayman for the sister islands. On medical advice, isolation accommodations have been made available to all persons arriving on flights from abroad who plan to continue to Cayman Brac or Little Cayman. This includes students as well as others. There is heightened concern given the limited resources on Cayman Brac and Little Cayman, the high percentage of elderly persons residing there, and the additional challenges for serious cases given the remoteness of the islands. For these reasons, all international travelers who planned to continue to the sister islands are being given accommodations to self-isolate at a dedicated hotel in Grand Cayman. We strongly urge persons not to continue through to the sister islands. We are therefore giving them the means to do the responsible thing and stay in place in Grand Cayman until the self-isolation period has expired or another provision can be made which can provide similar assurance.
Okay, Kevin?
Kevin Morales, Cayman Compass. Dr. Lee, just to confirm your opening statement, the people who preliminarily tested positive, the 2 new cases, they have been isolated since last Friday, it would be. Is that correct?
Dates are merging, but
I know,
yes.
right?
I think it was last Friday, yes.
Okay. And all 30 of the staff members there,
They were all isolated.
all and continue to be?
Yes, they continue to be.
And they won't...
Because the results are preliminary, we're treating them all, they all will continue to be preliminary until we say the results are not preliminary anymore.
And that's when CARPA
Exactly.
tests them. Okay, I just wanted to make sure on that. So obviously with Health City, everybody's aware of that situation, and it was a big deal when that announcement came out last Friday. For the average person who might not garner that kind of attention, if they test negative, is there more of a risk that they'll feel better about their situation and might not isolate anymore, like the staff members at HCCI did? Or are they told to also continue to isolate until CARPA, I guess, confirms their preliminary test?
Are you saying the people from the HSA now?
I'm just saying anybody going forward who might take a test, if they get a result back preliminarily that says negative, is there a risk that they could say, oh, I'm good to go and I don't need to isolate?
Yes, I can't say there's no risk. Yes, there's a risk, but I mean, they have been advised when they're being told their advice, when they've been given the advice that they have a preliminary negative result, they're being told immediately, but you must remain isolated until you get told otherwise.
So everybody is told that. Okay. Can you define? So, from our perspective, we're looking at it. The transmission occurred here in Cayman, even though it did come from a cruise ship passenger. Can you confirm kind of your definition of what a locally transmitted case might be then?
So that would basically, if a case popped up in the community where there was no known contact, no reason for them, so they hadn't traveled or they hadn't contacted anybody with COVID, or they didn't work in a healthcare facility, for example, where there was a subject, then we would say that was local transmission. We're essentially following the guidelines that are set out by the WHO in this regard. When probably there are locally transmitted cases, then your level you change a little bit. So at that point, somebody presenting with respiratory symptoms with no other cause, you assume that person has COVID, but we only say that when there is community transmission.
Okay, I see. And just about the reagents, can you give a rough estimate as to what is already here in Cayman? How many more tests that might be available for?
I can't, not because I'm trying to avoid the question, but it's not just. There are lots of different parts to this, and I know we have limitations in lots of the different parts. So although I know we probably have around 200 of one type of the test and about 300 that are coming, some of the reagents in the middle, which are essential parts of the process, I know we're running low on as well. And I'm not sure we've quantified exactly how much of that reagent is, but we've asked for supplies of everything that we need as urgently as we can get it.
How concerned are you that we might have to, I guess, pause testing?
There's a big hang-up about testing. There always is. Whatever the situation is in medicine, people always get really hung up about the result. But as I've said, but it's similar to the case of dengue. We treat this is not a case where currently we have any particular treatment that we can provide. It's what we call supportive care. So we do everything we can for the patient, provide them oxygen, provide them ventilation if they need it, respiratory, renal support, and so on. It doesn't change any of that would happen. So the only issue would change is if you know it's not COVID, you may relax some of the PPE equipment type stuff that you're using to look after somebody. But otherwise, they will get the same treatment in any event.
Thank you.
I just want to add to that we will be receiving this reagent from WHO and PAHO soon. They have been sent already, so they should be here shortly. But in the unlikely event that we run out of reagent, we will continue our regular process to send any suspect case to CARFA. And the director of the lab in CARFA have expressed their willingness to accept any amount of sample that we can send, that we should be sending to them.
Thank you.
Okay. Persons would like to know how the two positive result patients are doing. Do you know how are they feeling? How are they doing?
Of the people that had felt unwell, from what I understand I spoke to Dr. Benoit today, that they were not very severely affected. So
Okay. There's another question that I've gotten several times from the public. Many people are already complaining about telecoms, internet being extremely slow, crashing at some point, with children being out of school and having to study online, everybody doing that. They basically want to know how this will be addressed with the telecoms companies.
Well, we met with the telecoms last Saturday or Sunday, I don't remember which, and they were all satisfied that they had the systems they had in place were more than adequate to meet the load, the challenge that we're facing. So I haven't heard any complaints so far until now. So if they are, I think we'll have to take it up with the telecoms and see where they're at.
Okay. Ralph?
None of these are government agencies,
Right.
So
Ralph Lewis, Canine Times, and this few questions are for the Premier.
Let me get a little water first. Thank you, sir.
We really appreciate these regular briefings, and will they continue for some time to come, these daily briefings?
I'm afraid so.
This is my next question. Are you comfortable with the level of communication? And I hear the concern in your voice about getting people to do the right thing, but if they're not hearing or getting a message, they can't really do anything. Is there any measure or any way of finding out if the message is getting to all Atria Islands in all the areas? Or do you feel comfortable that most people are aware of what's happening and are knowledgeable of what they should be doing?
But I'll say this, we are utilizing virtually every means known to man to get the information out. We're using all of the social media platforms. We're using television. We're using radio. We're using print. We're streaming live. I really don't know what more we could possibly do. I think, I don't have the numbers in my head, but I think indications are that this is being very, very carefully followed. I know, judging from the messages I get, what time is the press conference today? That people are really, really paying attention to what we're saying.
So you would just say that it's also incumbent on the individual, on the residents, to also help their family and pass the message on?
Absolutely. I mean, we all have to take responsibility for the well-being of ourselves, the well-being of our family, and the well-being of the community. And especially when it is something that is a health threat, I think it's even more critical that people pay attention. And by and large, I think people are. I notice, and I think we all have, people's behaviors have changed, and the social distancing, I think, is becoming common practice. I smile to myself on a number of occasions this past week when I see young people greeting each other with the elbow bump. I said, well, it looks like some of the messaging is getting through.
And bringing it home, is there a central point where civil servants can put their questions to regarding this whole issue? We're getting questions asking me to ask you if the government has taken steps to protect the civil servants, and are they able to get this information and to see the press briefings, and instead of you having to say so, maybe there's a central point that you can indicate that they can contact and the civil servants to get information to the questions.
I mean, I think we're obviously putting out information to everybody, which includes civil servants, but I think that's also about each individual team's, the way they communicate with their teams about what is going on. So I think it's happening. I think my sense is civil servants do feel informed, but we'll always look at what more we can do, and I will mention that to the Deputy Governor after this.
Regarding structure, can you say what's the structure for dealing with this crisis? Who's spearheading the whole operation? Is it the cabinet or is it the hazard management department? It's good to know how the structure is created. If you look at the U.S., the vice president is spearheading their structure, and so if you can give an idea of how the structure has been spearheaded to deal with the crisis.
The governor and I are spearheading this this process. We've got a lot of advisory committees along the way, and cabinet obviously makes almost all of the key decisions after full consideration. But I suppose if there are two people that are spearheading this, it's the governor and I.
And I would just add that the structures underneath Cabinet are functioning really well as well. We have the NEOC, the National Emergency Operations Committee, and there's a policy group. And we've got people from all the agencies and a cross-government approach who are bringing forward recommendations and policy advice, which comes up to Cabinet, and then Cabinet sort of takes the decision. So it is the sort of structure you use in any crisis to make sure you're nimble, but you're also considering all the various factors you need to take into account.
I'm almost at the end of my list. I would recommend that you take some ginger tea on a regular basis and make sure that you're looking after yourself, because we're in for a long haul. Strategically, after 3 weeks have gone by, and hopefully we don't have any more positive results, is there a medium to long-term plan of how we're going to move forward? The whole world outside is dealing with their crises, and because of our size, we may be in a better position. But if that's the case, do we open the doors or do we stay locked up? And these are the kind of questions that are going to come out in the next couple of 3 weeks. Is going to go very quickly, and we'd like to know if there's plans on how to deal with that when it comes.
But those are the kind of questions that keep me awake every night. I read everything I can possibly find. I watch everything I can possibly see, just to see what's happening in the rest of the world. And this really is a big question. What transpired yesterday in China, I think is something we all have to watch very carefully, because they have managed to stamp out the local transmission of the virus. They are now dealing with, this is so ironic, with the importation of the virus back into China by Chinese people who were resident in North America or Europe. So the struggle for us and everywhere else is with the virus raging all around us, and with what was the ease of international travel. It's not easy anymore. As soon as we open our doors, if the virus is still raging, it'll be here again. So we have to really think much longer term than just the 3 weeks lockdown, because what I see happening, particularly in the United States, which is, I don't see this going away in 3 or 6 weeks or even 9 weeks. So, I mean, the governor and I have already talked about. Kim and I's government is in a very solid position, probably for 4 months, even if we don't earn another penny or another cent. But beyond that, our people have to live, to eat, to pay, pay the usual outgoings of life and be provided with the basics. I don't think any country in the world has the answer to what happens beyond 6 weeks or 2 months. But we are continuing to grapple with this question because we will have to face it at some point. But the whole thing is moving so fast and in ways that you can't even predict that it's impossible to sit here today and say what we will do precisely in 3 weeks' time. I think the most likely decision 3 weeks from now is an extension of the current state. I think that's the most likely prediction.
That brings me to the next question from the public. How many cases do we have to reach before we decide to do what, let's say, Italy has done?
Well, I'll ask Dr. Lee or Dr. Williams to speak to that, but again, we keep repeating, it comes down to the nature. If we keep identifying cases which we know the source, in other words, this isn't Mary Ebanks, who has not left Cayman in 3 months and has not worked in a healthcare facility, does not know that she was in contact with anybody who had the virus. She just presents with the symptoms. Mm-hmm. Now we have a problem because we don't know where that came from. Now we know for sure we're into community transmission. And then, as Dr. Lee said, the protocol changes.
Just wanted to ask the question again. As you know, people are either missing the answers or they just want to hear it again. Commissioner Byrne, earlier, His Excellency talked about fake news and repercussions there for persons who may be spreading that. And earlier today, we all experienced, I think, most of us in this room at least, some fake news that was on WhatsApp and so on and so forth about government officials going to people's homes in a certain area. What types of plans are in place to avoid that from happening, or what should people do if someone shows up at their home in that case?
Thank you, Donna. Good afternoon. So I can confirm that we did receive a report this morning of 2 persons in the Prospect area representing themselves as government employees, sanitising houses. That was a fake report. It's a scam. There is no such process in place. We did dispatch a police unit. We don't have any suspects at the moment. And I am sending out a crime prevention advisory note now to advise members of our communities that this is a scam, that the government have not engaged in any such activity. So that will be gone out this afternoon. You mentioned the wider aspect of false reporting. I've commented on that. His Excellency has commented on that. It creates an unnecessary panic and unnecessary fear and anxiety and adds to the stress. We don't need it. And certainly the police service don't need it. So I ask and I encourage the communities to work with us. There's no need for this. There's very accurate, timely, and very informative information being distributed regularly by government to keep everyone informed. There's no need to listen to any other type of invalid news.
Okay, thank you, Commissioner Byrne. Question from Felicia?
Felicia Rankin-Solins for Radio Cayman. Do people need to isolate if they don't have symptoms but may have had third-party contact with someone else being tested?
If somebody's being tested, means that he's or she is a suspect. So until we got a final report for that particular person, all households need to stay isolated as well.
And with the news that there's so many students soon returning to Cayman, there are a lot of people who seem to be very concerned and have very little faith in young Caymanians' ability to behave themselves. And even though they know that they are instructed to self-isolate and even have the option to stay in a hotel, believe that maybe there should be further precautions taken, like perhaps someone watching to make sure that they don't sneak out of their rooms and meet friends and hang out. There are people who have these concerns that they'll still do this anyways. Do you think it would ever have to come to that?
Well, there will be security personnel, monitors. Let me use a less strident term. Monitors there on the site to do their very best to ensure compliance with the rules, which is the whole purpose of them going there for them in the first place. So I have two boys. One is almost 28 and one is almost 25 now. I have some experience with young people, but this is the cream of Cayman. This is the next generation who are going to take leadership roles in this community, and the reason they're at university is because they clearly have some solid gray matter between their ears. So I believe that we can appeal to them and we can have some confidence in their ability and their judgment. Not so much because a lot of young people, are fairly cavalier about that. I remember how I felt at that age. Nothing can happen to me. I'm completely invulnerable, indestructible. But to understand that it's not really just about them, but about the risk they pose to people that they love, their grandparents, their aunt, their uncle, their mother, their father, as well as the broader community, and that they must self-isolate for that purpose, if for no other.
Thank you. That's all my questions.
Premier McLaughlin, any decisions made about public bus, public transport? I know about them having to stop running.
No, as I said when I spoke about this a couple of days ago, people I think, including the bus drivers, have to behave responsibly in terms of the seating, not crowd the buses in the way that sometimes they do, so that there is some degree of distance between individuals. They don't have to be touching other people while they do it. They are just, to close down public transport would create another set of issues. It's like closing the supermarkets. I mean, based on all the principles that we've talked about with respect to risk, the riskiest public gathering that I see there now is going to the supermarket because of the sheer numbers of people that are there all the time. But we can't close down the supermarkets. And if we say we restrict the number inside the supermarket to 50 or 40, they're simply going to queue outside the door. Mm-hmm. So we're grappling with how we manage these things. And there are going to continue to be risks inherent in just living as long as you have this virus around. We're doing everything we can to minimize them by changing social behavior and putting in place rules and protocols and providing advice. But at the end of the day, people have to take responsibility for themselves and make judgments about, should I go in there and the place is packed full? Maybe I can wait until it's not quite so many people there.
Commissioner Byrne, you weren't here earlier this week, and a few people have asked this question already. Excuse me, sorry. But there are a lot of people, obviously, who are going to be out of work. And there's a concern that crime will be on the increase, burglaries, whatever. How is your department planning to tackle that?
Thanks, Donna. So we're operating on a very stable platform at the moment. Just looking with my senior command team this morning, then everything is very stable on the sister islands, full resource availability. We have a small reduction here with some people in isolation, self-isolation for the right reasons and in compliance with the advisory directives that have been issued. No spike in crime, absolutely no spike in crime whatsoever. We do have some burglary commissions not associated with COVID. In fact, we were on an operation this morning to look at burglary commissions, searched the house, and two persons happened to evade us, so they're wanted for burglary. So absolutely no spike. We are going to pay particular attention to issues around domestic violence. It's something we do have a concern around, but nothing empirical to say there's any increase or any spike. But just with people in homes more confined for longer periods, it's something we're going to keep an eye on, and we've been speaking about it at our command teams. But a very stable platform as it is at the moment.
Okay, thank you, Commissioner. Rashma?
Thank you. Premier, this one is for you. Today, the UK published an emergency bill that has some wide-reaching provisions. Is this something that you and your government is contemplating, an emergency COVID-19 legislation that would have wide-reaching implications for freedom of movement, those sorts of restrictions, apart from what we already have?
No, we're not.
Okay. Sorry.
Okay, we have a few more questions. I think some of these have came in yesterday, and we weren't able to answer them. One of them is it possible for government fees to be paid by direct deposit as opposed to checks? Because obviously a lot of departments are personnel is working from home, and payments are required usually through checks. So they're wondering whether some systems will be set up in place for all of the online businesses to actually have direct payment as opposed to having to issue checks.
I think it was yesterday when Minister Hugh was here that he said there were 36. I believe it was him. There were 36 agencies or services or whatever that could be paid already by online payments. Okay. Obviously, we can have a look and see what is possible. I don't know. I'm not a technical person, and haven't had a brief on this. I don't know how difficult it is to do these things. To introduce a new one, and whether the current platform is capable of doing it. But it is certainly something that we should look at, not just for COVID-19, but the more that you can get through these transactions without having to have a person in between to make the transaction, I think generally is more efficient it becomes. But I'll take that on board, and we'll have a look at that and see what further services it might be possible to be done that way.
Okay. Also, there are several people, I'd say, from that contacted me personally that said that they're working. They've been in contact with people who have a travel history, but they have to go to work because their employers are saying, you have to work, you have to come into work. Like, isolation is not, it's voluntary, but they feel like they're being forced to go to work when they know they've been in contact or have family members living in the same house that have a travel history. How do people deal with that? Is the question.
Well, I think that is not just reckless, but is very short-sighted on the part of any employer who does that. What happens if your entire staff becomes ill? So I would urge those individuals to report those things to a government through the work system. Get the information to us, because now you're possibly occasioning major public health risk, and we'll have to find some way to deal with that through the relevant law.
Okay. One person mentioned isolation of persons, or since there's not a law that tackles isolation as such, and putting it in place is not at that point yet. But somebody mentioned maybe looking at a curfew under the law that would be under for persons who should be in isolation.
Well, a curfew for people who should be in isolation. I'm not sure we could do that.
24-hour curfew, I guess.
It would have to be a curfew for everybody. We'd have to be a curfew for everybody. I hope we don't get to the point where curfews become necessary. One of the things, I know lots of people are panicking now because this is all. It feels like something is closing down on you, right? I know the feeling. lived through enough hurricane threats to understand exactly. I got the same sort of feeling of urgency in my mind all the time. But we have to remember that this is a sustained period. We don't know quite how long that period will be. We've tried, and we're still doing our very best to ensure that our response as a government is rational and proportionate to the perceived risk at the time. Because we can't lock the place down indefinitely so that people can't move. And the longer it takes before we get to that point, hopefully we never get to that point, the better. Because it becomes impossible to exist beyond a certain point in such circumstances. So the longer we can delay having the virus take control, and if we can prevent it altogether, we never have to get to that particular point. So that's why we're focusing the way we are. We're still in the containment sort of phase, so that we can still identify who you got it from and put a ring around those people and the people that are known contacts of that individual. So let's pray and hope and continue to do everything we can to keep it the way it is now, and then a curfew won't be necessary.
Thank you.
Thank you. Premier, I just want to go back to a point that you would have made earlier this week about creation of an NAU command center. I think you said it would have been for staff, for people who may require NAU assistance.
Not a command center, people are working from home.
Okay, so
trying to keep people apart.
Okay, fair enough. I stand corrected. People have been saying that they've tried to call the NAU to get assistance to apply to access the funds that you've said that would be made available to them. Can you provide us with an update on how you're managing? Is there going to be creation of a hotline or something that can assist people who really need to get access to these funds?
Well, NAU is functioning the way it always functions. There's an assessment process. I don't have precise details today. I will undertake when we leave here to speak to Councillor Harris and the chief officer, so that I can get a proper briefing on how the process, how well or not the process is currently going, and I can let you have that as soon as I can. Because otherwise I'm just going to be speculating now based on what persons have said to you.
Okay, now the commissioner touched on this, and I've asked you this before about people breaking the request, as it were, to stay at home. We've had reports of some Caymanian students who returned this week are being seen out and about at the supermarket, heading to purchase alcoholic beverages, things like that. I mean, I know you've repeatedly said this, that people need to stay home. Can the police commissioner, or is there any sort of other ways that you can restrict them without going to the extent of a curfew or any sort of legal changes?
There is no legal requirement, and it's not just the students. I know big business people, big professionals in this community who get off the plane and go straight to their office. So, you know, this is a major issue. But it's not just the students. Everybody's zeroing in on students, but I can tell you there are otherwise responsible business and professional people in this community who are not doing what they should be doing either.
Mr. Byrne, earlier this week, we heard about increased visibility, increased patrols. Can you tell me a little bit about what that means for the scheduling and the staffing of the RCIPS? Are people going to be racking up overtime, or are we just kind of shifting things around, or is it literally just they were working anyway and now they're just kind of out?
So just at this current time, overtime is being used to supplement and augment the regular shift for high visibility patrols. From Monday the 30th of March, we moved to a new 12-hour shift roster. That has been agreed with the associations, the police associations and the welfare. And what that does is it creates us with a 2-shift system, Alpha Bravo team type approach, separating the teams into 12-hour tours. So they work longer hours but less days. So we will have higher visibility, more persons on those units. We have redirected our traffic resources and our community policing resources, our firearms response unit resources and our Canine unit resources, and they are all performing high visibility patrols. We're visiting supermarkets, banks, the hospital. Today and for the remainder of the weekend, we'll be paying particular attention to the airports, and then we also maintain our response for frontline shift reports. So I think you're going to see a lot of increased patrols over a 24-hour period for the foreseeable future.
Will the RCIPS need any assistance from government to help cover that overtime?
I have no difficulty with constraints. I'm not under any constraints at the minute.
All right, thank you. And how long do you think, just realistically, that your officers can kind of maintain 12-hour shifts?
So this has, as I said, something has been agreed. So the shift, by virtue of being 12 hours, is 4 days on, 4 days off. It builds in maximum resilience and is the best considered roster for work-family life balance in terms of the current operating environment we're in. It's been very well received. I'm very encouraged by the results and the cooperative approach from our associations and the team, and I think it gives us a short to medium platform for operating in this current environment.
Okay, thank you. And one question for the Premier. Mr. McLaughlin, we've received, some people are writing in, falling into these very odd immigration circumstances where, they might be up against their term limit and their limit is up during the next 3 weeks. Or, there might be somebody who can't make it out by Sunday, but their, permit is up or something like that. Technically, they're overstaying by the letter of the law. Will immigration kind of give people a break in these cases until the airport opens back up and they can get out?
Absolutely. Absolutely.
Thank you. That's it.
Okay, I have a question for the doctors on the panel. Wendy from Command News Service would like to know, she wants some clarification on the tests. She says she understands that there were 400 test kits. She has counted only about 70 tests have been done so far, but Dr. Williams, she said that you spoke of at least 300 people on the island having respiratory infections. So she wants a clarification on the tests.
Let me just first clarify about the 300 number. That was the number of flu-like symptoms that we reported on a weekly basis, and that was for the month of February. So there's not that currently there are 300 persons with flu-like symptoms here. And even though if we're seeing 300 persons with flu-like symptoms, most of them have no travel history and doesn't meet the criteria to be tested. When it comes to the number of reagent that was received, like Dr. Lee actually explained earlier, the tests have different process, and also they need to be a screening test and also confirmatory tests. So 300 or 400 reagent doesn't really mean 400 patients. So that's why we will use more reagent with one single patient. And also if this test comes positive, we have to redo it again. So several reagent is using on one single case, and that's why the number of reagent is going down now, although we have some reagent in the way to the Cayman Island.
Okay, thank you for the clarification. Any more questions?
This question is for the doctor. We are indeed in stressful times. Have you seen an increase in other medical situations for the hospital, for example, clients?
Not really. We continue to see patients with the regular chronic condition, hypertension, diabetes, and so we are making arrangement though, because we're expecting that from a mental health perspective, there is a lot of anxiety there, just to provide that support for the public, and also for the public, but also for government employee and from the HSA staff. But we will provide that type of support. But so far, we have not seen an increase of any other medical condition, at least at this time.
Any further questions?
See you tomorrow.
Good effort.
Okay, Reshma. This will be our final question.
This is for Dr. Williams. Now that we have 2 positive cases, can you share with us what sort of capacity in terms of the staff at the hospital preparing for if we have any community transmission? And by staff, I mean ICU nurses who are trained to use the ventilator beds.
All right. As you have said, we still don't have any local transmission, but the hospital have been preparing for weeks now, even before we had our first case in Cayman Island, just to get ready, not only when it comes to staff, but also to equipment. And we have received the approval from government to acquire ventilators and other beds. We have prepared a respiratory unit to treat this patient. We are also in communication with the Health Practice Commission in order to recruit the additional staff that may be needed if we have a large outbreak. At this time, we have the staff ready to manage the cases that may come initially, but if the outbreak expands, we will definitely are looking to recruit other additional staff from other islands around the Caribbean.
Okay, I did receive 2 more questions.
Can I just add to that? If
Go ahead, Dr.
I think it's really important to just reiterate, Reshma, that the vast majority of people on the island are going to get through this without a problem. We know that 80% of people will have mild symptoms. They will have flu-like symptoms. And actually, as we've seen, some of the people who've been unwell, they've come through on the island very easily through it. So that needs to be remembered by everybody. And there is a proportion of people, it could be 30, could be 40, could be a larger percentage, who won't even get it. So we really need to remember that and bear in mind that we are well supplied for medical care on the island with the numbers of doctors and staff per head and so on. We're doing well.
Premier McLaughlin, earlier this week you talked about essential staff being able to travel to the sister islands once the ban has been placed on travel on Sunday. One person wants to know, they work with a telecoms company and have to do regular maintenance on the sister islands to keep them, especially at this time, on top of, being able to use the internet. Would they be considered essential staff?
I would think so. There is a protocol that's being developed. I'd hope to have it today, but I should certainly have it by tomorrow. Mm-hmm. That's been developed about how that is dealt with. Travel to Cayman Bracken, Little Cayman.
Okay.
Yeah.
And I think that's it. If we have no more questions, we thank everybody for being here with us today for the press briefing today. Again, get your questions in to members of the media as well as the team here at GIS so that we can have them answered for you tomorrow. Until then, have a great evening.